Hi everyone, it's Mia from the Oppo File here, and today I want to talk a little bit about single payer and Medicare for all. After the victory last week where we stopped Trump Care, yay! A lot of people have been talking about the next steps. And of course, we all want to expand the ACA and increase universal coverage and help healthcare for all. However, there's some problems with doing that through Medicare for all. First and foremost, and I can't stress this enough, Medicare for all cannot legally cover abortions. I know. Maybe you didn't know that. It's pretty scary. A lot of us have been talking about something called the Hyde Amendment. Unfortunately, the Hyde Amendment is something that prohibits federal funds from funding abortions. That means currently abortions can't be covered under Planned Parenthood, well, not through federal funds, and they can't be covered through Medicare. Now, if we expand Medicare and we kind of limit private insurance, that means that abortions won't be covered for anyone through Medicare for all. We can say that we should repeal the Hyde Amendment, and hey, I'm all for that. I want to repeal the Hyde Amendment, but right now it's law. And one of Trump's first acts was to sign an executive order expanding the Hyde Amendment and trying to make it permanent. Now, I just don't have confidence right now that in trying to pass Medicare for all, we can also repeal the Hyde Amendment. So please, when thinking about the next steps forward, remember, Medicare for all cannot cover abortions at all. If we pass Medicare for all, no one who is middle class or lower can get an abortion covered. Okay, now, there are a few other problems with Medicare for all or single payer. Right now, the US does most medical innovations in the world, which allows for other countries in Europe and Canada to have a government-controlled healthcare system because we're doing a lot of medical innovations. If we switch to a Medicare for all or a single payer system, then there will be no one doing these medical innovations. Countries with single payer also have much longer wait times. And often countries like Canada have people coming to the US for their health care. But of course, like most things, this will impact poor and middle class people the most because rich people will always be able to find ways to fund their health care. They'll either pay it out of pocket or they'll travel to a different country. Also, right now, the US has many more things like CTs, MRIs, because insurance pays for them. We also have much faster wait times to see a doctor for surgery. In other countries, sometimes people die waiting for their surgeries or die because post-op complications that aren't treated fast enough. Mammograms are done much more often here. We have uterine lining testing done more often here. All of these things happen faster, and we have much more cutting-edge technology. You have more healthcare choices. You don't have to worry about being on dialysis forever because the government won't approve a transplant. If you need to decide between medication for the rest of your life or a quick surgery under a single payer system, the government might decide that it's more cost efficient to do medication forever, and then you won't get your surgery. What we're talking about with single payer or Medicare for all is the government basically making your healthcare choices. Now, I want everyone covered. I want universal coverage. I want to work towards expanding Medicare. I want to work towards expanding the ACA. But I'm not ready to give over my healthcare choices to the government, especially Trump's government, and especially a government controlled by Republicans who want to control women's bodily autonomy. This is a complicated conversation, and we should continue talking about it. But keep in mind these facts, and don't forget about the Hyde Amendment. Thanks, everyone.